other day, I was talking to whoever mind about today. And all they could say was no one knows tomorrow. Said I can read the work of child, I can come and be the river from the sunshine. Well, that's as far as my guess goes.
Good morning. It's a bright Tuesday morning here in Ikeja, Lagos. Welcome to Health Convos show on Niger Health Radio, your wellness companion. My name is Ogo and I am with Dr. Adeola. She's the head prevention, care and treatment services of Equitable Health Access Initiative. How are you doing today, Dr. Adeola?
Good morning, Ogo. I'm good too. I think I feel as bright as the day. Yes.
That's very good. Meanwhile, I love this your Ankara thing.
Thank you.
Lovely.
Remind me to tell you the story behind it after the show.
After the show, I'll do that. Okay. Today we'll be talking about accepting cesarean section, which is commonly known as CS. When I hear the word CS, I smile. Just the way I'm smiling now. Because going down memory lane, I remember when I was pregnant with my first child, I went to see the doctor. After the normal examination, the doctor told me, "Madam, you'll be having a cesarean section."
Wow.
I looked at him. He said, "Yes."
You rejected it.
I did not reject. I just looked at him. He said, because of the positioning of your baby, you'll be needing a cesarean section. My heart skipped, but I accepted. I was like, okay, it's fine. Now back to the question, Dr. Adeola. On cesarean section, what is CS and who needs a cesarean section?
Okay, like you said, cesarean section, sometimes called C-section, is actually cesarean delivery or surgical procedure by which one or more babies are delivered through an incision on the woman's abdomen and the uterus. So it's a surgical procedure. An incision is made on the woman's abdomen and uterus. So who needs a cesarean section? A pregnant woman. And I guess we'll talk more about yes. Yeah.
Okay. So like I mentioned earlier on that the doctor told me because of the positioning of my baby, that was why I needed it. So I would like to ask, what are the reasons for cesarean section?
Of course, like you've mentioned, the position of your baby is one of the reasons why cesarean section may be indicated. Let me just say generally that it's often performed because vaginal delivery would put the baby or the mother at risk.
Okay.
And so that's usually because the mother of the baby is at risk. Sometimes it could be both of them. Now, at the back of the mind of the healthcare provider, their desire is to have a healthy baby and a healthy mother. So anything that is going to make that impossible, then they want to address it. A cesarean section is one of the ways of ensuring you have a healthy baby and a healthy mother. Now, beyond that, I would say that there are many reasons why cesarean section may be needed. And let me also say that cesarean section could either be planned, or that is elective, or an emergency. So it could be an elective. For you now, you had a planned elective cesarean section because you knew even before your delivery date that, your mind was already prepared for it. For some cases, it's at the point of delivery that decision to have a cesarean section is made. That means it's an emergency. So the number one reason, like 30% of cesarean section, most common reason is what we call cephalopelvic disproportion. Cephalo means head. Pelvic, yes. Oh, okay. And then pelvic means the pelvic area of the mother. So when there is a disproportion between the size of the baby and the pelvis of the mother, it could be a very big baby, it could be a mother with a small pelvis. Okay. And this has nothing to do with your size. So sometimes people feel it's small women that have small pelvis. You could actually have so when there is a disproportion, meaning that the baby's head cannot pass through the pelvis for whatever reason, it could be an indication. The presentation, it could be bridge. The baby is lying by the side. You know, babies could lie in different positions. It could also be twin pregnancy. Sometimes, especially when the first baby is not coming with the head, it could be an indication for CS. There are also some conditions in the mother. A mother that has a very serious heart condition that may not be able to go through the stress of labor, and the doctor is already aware. Sometimes also, it could also be the condition of the baby too. The baby has been assessed before delivery, and the doctor feels that this baby will not be able to go through the stress of labor. Sometimes when there are transmissible diseases, like HIV, it could also be an indication for CS to reduce the risk of transmission from the mother to the baby. Yeah. And low-lying placenta. The placenta is that part of the pregnancy that supplies nutrition to the baby. If it's lying at a position that the placenta is supposed to come after the baby, not before the baby. So if the placenta is lying at a position where it may come before the baby or may cause bleeding at the point of delivery. And the doctor has already seen it. Now, for most of the things I've mentioned, there are indications for elective CS. They could also be the indication for emergency CS if the care provider has not done his homework very well. So by the time the woman is in the third trimester, the doctors usually do a pelvic assessment. So they don't wait until the woman is in labor to find out whether the pelvic is adequate or not. An ultrasound would have been done. You would have seen where the placenta is. Even the size of the baby, would have been guesstimated. You would have guessed. Sometimes the ultrasound will even give you like the clothes size, weight of the baby. So most of the indications for elective CS, if those decisions are not made early, then they become indications for emergency CS. Let me say lastly that sometimes the maternal request, sometimes for many reasons, the mother of the family, that's the parents, can decide that we don't want to have a vaginal delivery for this pregnancy. We have decided we are going to do a CS. So these are some of the main reasons why women have cesarean sections.
Okay, so my next question, sometimes I don't want to use the word most times because nobody is happy hearing that a woman goes to the hospital to have a baby and she does not make it or the baby does not make it. So how has CS reduced infant and maternal deaths?
Okay. So before I go to death, let me just say that this idea that CS reduces death alone, CS does more than reduce death. It actually improves the outcome of the mother and the baby. Now, you see some women who would have a baby with brain injury, nerve injury. Some babies, you see their wrist bent, Some of them, those babies were normal until they were about to be born. It is at the point of birth that the decision to do the CS was not made and the baby was forced out. And then you see them coming. So it's not just, CS does not prevent death. It also prevents morbidity. It prevents babies whose brains don't develop, who don't have, whose hands can move, whose legs can move, who walk at the right time, who talks at the right time. It prevents many other complications. Even for the mother too, it prevents hemorrhage, it prevents tears in the mother too. Even if the mother survives, So some nerve damage too. In fact, some women have some complications like foot drops and all that as a result of having vaginal delivery or maybe there was obstruction of labor and the decision to do CS was not made on time. So what I would say is just that generally in let me talk about Nigeria.
Okay.
Okay, so some studies have been done, and of course, like you would have guessed, women who are educated and are of higher economic status have more access to CS, because like we all know, CS costs more money than vaginal delivery. So it has been found that mortality rates in mothers and babies of women who have higher economic status and who are more educated and have better access and are able to afford CS is lower. So there are better outcomes. So women who have access to cesarean section have lower risk of death, and their babies also have lower risk of death. So cesarean section has actually been, you know, if you look at the history of cesarean section in the 1800s, it was actually initially done to save a baby from a dead mother.
Oh, really?
Yes. So the mother is dead, and the baby is
alive.
Yes, and they're like, let's just cut this woman and bring the baby out. And then as we moved on, it became something to even save the life of the mother. Sometimes the baby is not the one at risk, it's the mother. So that is how fast cesarean section has been. And the figures have been, reduced maternal mortality in like 10-year period when access to cesarean section increased in low to middle income country like Nigeria, dropped like by 2.9%.
Nice. Okay. So this is funny because we hear some women at the mention of CS, they will start casting and binding. God forbid, though, it's not my portion. Hey, I will deliver like the Hebrew women. Yes, cesarean section is not of me, it's not of the children of God, it's not blah blah blah. You know, they come up with a whole lot of drama. Once they hear, Madam, you'll be having a CS. So, why are women skeptical about CS?
Okay, the reasons are many. I would start with myself.
Okay.
You know, I had my own second daughter via cesarean section. It wasn't something I expected. It wasn't. I had the first one was going to be via CS, and then at the last minute, I was just discovered that I was in labor. I was 4 cm dilated. CS was not going to be needed again, and boom, you know. So when the second one came to, and then it was looking like I was going to have a CS, trust your sister. I was believing that the God that did the first time is going to do it again.
I know.
And the baby is going to come via the vagina. You know, but at a point, you know, thank God for the Holy Spirit. I just knew that, so this is your God. He works through different ways.
Exactly.
So the number one reason, especially in our environment, why people actually are skeptical about CS is because of their faith, spiritual reasons.
Yes.
Spiritual reasons. People just believe that going through CS is lack of faith. The pastor has prayed, has prophesied over your life that you are going to have this baby, have vagina. It must happen. So it shows lack of faith. Let me tell you a story. You know, there was a church I learned, and the pastor had discouraged many of his church members from having CS. Okay, and then his wife was pregnant, and she needed CS.
Interesting.
Pastor's wife had CS.
Okay,
and they hid it from the church. And you know truth. If you cover it up in the grave, it is going to come out again. So someday, the news started filtering out that pastor's wife had CS. You can imagine how the congregation felt. You know,
this is something,
and you can imagine that the pastor, for spiritual reasons, the pastor got to a point where he discovered that my wife needs CS, and he couldn't come out to say my wife had CS. So that's how far some people take their faith. So spiritual reasons. There are also myths, social reasons. You find some cultures, they will tell you that you are not a real woman if you didn't. A woman must go through labor pains, that push, and the baby must come through the vagina. So they say the woman is not yet a real woman. You know, in Yoruba they will even say, meaning that if you did not do that ikunle thing of of having the baby yourself. You didn't have a baby, So that one is there. In fact, they say normal delivery, meaning that CS is abnormal. Do you understand? But it's not so. It's either vaginal or cesarean section. Yeah. Both of them are normal, really. Yes. And then there's this myth that once you go through a CS once, then every other pregnancy has to be by cesarean section. Also, there are financial reasons, just like we alluded to earlier on, that it costs more to have a cesarean section than to have a vaginal delivery. So some people are skeptical. When I know what is in my purse, you understand? It could also be another reason. And then I would say that there are some personal reasons. Some women don't want scars on their body. They want to be able to wear their bikini during summer and all that. And because of that, they don't. And then there is the fear of being put to sleep. Although most cesarean sections now, you don't even need to put the woman to sleep.
I was awake.
Yeah, yes. So some are afraid of being put to sleep. And lastly, I would say there are some medical conditions that make people skeptical. Women who know they have some underlying medical conditions that they feel could, and then fear of blood transfusion. Hemorrhage is a possible complication of cesarean section, and most of us don't want to be giving another person's blood. So that fear of blood transfusion could also make people skeptical of cesarean section.
Thank you, Dr. Adeola. We'll be going on a musical break. We'll be right back. Don't touch that dial.
I love that song.
I know. Every day I will pray for you. That was Duduke, a song by Nigerian singer Simi. It was released in 2020. Welcome back to the show. You're still listening to Health Convo on Niger Health Radio. My name is Ogo, and I am here with Dr. Adeola. Dr. Adeola, welcome back.
Thank you.
That was an interesting musical break. Okay, still on the topic, accepting cesarean section. Still on the topic, accepting cesarean section. Dr. Adeola would like to know, are there chances of normal delivery after a cesarean section?
Okay. It's good you asked this question because, like I mentioned earlier, one of the reasons why women don't want to go through cesarean section is because they think that subsequent pregnancies deliveries would have to be through cesarean section. But yes, there are chances. And the chances could be as high as 60 to 80%.
Okay.
Yes. the chances reduce the more the number of cesarean section you have had. So the chances of having a vaginal delivery, not a normal delivery, a vaginal delivery after a cesarean section could be as high as 80%.
Okay.
Yeah. Okay. Yeah, that's it.
Okay. Okay, let's talk about sometimes women they have this guilt, especially when they listen to their fellow women talking about how they pushed, how they were induced, how they were screaming and they were pushing and baby came out. So sometimes they feel bad or they feel guilt that if I would have tried pushing, so that I also tell my story. So how can the guilt women feel after CS be addressed?
Okay, so Ogo, did you have any guilt?
At all. In fact, I when I was going to have my second baby, when the doctor asked me, I said, "Doctor, please, CS, give me my dates." Yeah, so there was no guilt, but I know some.
So
women
so the first thing is do they need to go on that guilt journey? Do they need to have the guilt? I didn't have any guilt because when I saw my daughter and I saw the outcome of this 9 months experience, I just felt satisfied that things have gone as planned. I wanted a live baby, healthy baby, and I have it. So the first thing is that when the woman looks at the baby she has gone through that procedure to have, that should take all the guilt away. Just like the pain of labor wears off with the sight of the baby. So number one, I want to beg women, please don't even allow anybody to make you feel guilty, because you feel guilt when you have committed an offense or when you have done something wrong. You have done well for your child. You have done well for your baby. Some people are dead and their babies are alive because they didn't take that decision on time. True. And then they have somebody else taking care of their child. So don't feel guilt because you have made a decision to be available for your child. And don't feel guilty because you have made a decision to make sure that you have a live baby and to have a baby that does not have any complications. A baby that is walking, that can talk at the right time, that can sit at the right time, that can suckle at the right time and doesn't have any deformity. Please don't and please, when they are sharing their push experience, share your own CS experience. Yes. So those who have had labor experience, you say, you need to know how it is to go through CS. You see, when you enter, they first do this. In fact, we were just chatting all through, but there was, so please share your own experience too. Don't feel you have not done anything wrong. So there's no need to feel guilty.
So dear mothers, you've heard that. Don't feel guilty. There's nothing wrong, there's nothing bad in having your baby via cesarean section. Now, the society too, they are not helping matters. Okay, so how can the society be further enlightening about cesarean section?
For me, I would actually say the first focus should be religious homes.
I agree.
Especially in our setting where we are very religious.
I agree.
In fact, people listen to their religious leaders, their pastors and their imams more than they will listen to the doctor. Okay? So if pastor is not afraid to talk about how his wife went through cesarean section on the pulpit and how God helped them, I think it would go a long way. So we should start with the religious homes and let them allow women. I would use that word allow. Let them allow women to use their faith or their belief to go through cesarean section. I would also say that even healthcare providers too, during antenatal care, you go for some health talks during antenatal and they are saying, all you lazy women who don't push your head, eat very well so that you can push during delivery. In fact, sometimes during health talk, it is never mentioned that there is a chance you can have cesarean section. Because hospitals also want to give women the impression that we are the place where you deliver per vagina, because they know that is what most women want. So we should also, healthcare providers should also up their game in giving complete information to both the wife and the mother and the father. Yes, and male engagement too is very important. Let me tell you this quick story. So when I was in my, I think it was in my 5th year or 6th year of medical school.
Okay.
So there was this woman that had an indication for cesarean section. You know how it is in our setting. The woman is in labor. They already had their families around waiting to hear that the baby is out. And the doctor called the man to the side and said, your wife needs a cesarean section. He said they can't sign the consent form. Now, the wife was already unconscious. So it was in the husband's role to make the decision for the wife. He said the people outside must not hear that his wife had CS. The doctor called him and said, you know what, you don't need to tell anybody that your wife had CS. Sign this form. Let us take your wife to the theater. And the man signed the form. And they took the woman to the theater. She had the baby. She came back again, and everybody outside was happy. You can imagine how things could have gone if the male had not been properly engaged to be able to, agree with the healthcare provider. So those are some of the things that we can do to help the society.
Thank you so much, Dr. Adeola, for educating us on the cesarean section, all we need to know about the cesarean section. And I'm sure that our listeners, we've learned a lot, and whatever negative mindset you've had about cesarean section should go away.
Yeah.
That will be all on the show today. Follow us on Instagram and Facebook on Niger Health Radio. Join us next week, Tuesday, same time, same link. Bye.
Bye.
Dear Lagosians, the attention of the Lagos State government has been drawn to the unprofessional practices of some healthcare facilities